Good afternoon, everyone. My name is Parisa Verma, and it is an honor to welcome you today to the Global Health and Equality Moonshot. I am a second-year student at Yale University, where I am a global health scholar, and I am majoring in cognitive science and studying Mandarin and Chinese, and I'm also a violinist with the Yale Symphony Orchestra. As a cognitive scientist, a linguist, and a musician, I am interested in the intersection of sound, of expression and communication, and of patient-centered care. I believe that across diverse healthcare models, whether a country offers universal coverage or leans more on the private sector, the patient-physician relationship is the singular constant. My goal is to explore how language, culture, and the cognition of communication can improve how physicians interact with their patients and enhance healthcare equity and well-being for patients across populations. Today in the Global Health and Equality Moonshot, we will take a similarly interdisciplinary approach. After all, health disparities are shaped by so much more than just access to medical care or lack thereof. They are the product of systemic inequities, of social determinants, and of cultural biases that demand a multifaceted response. So today's Moonshot is a call to action for bold, innovative, and interdisciplinary solutions to bridge healthcare gaps worldwide. That is why I am thrilled to introduce our incredible moderator, Ms. Aleksandra Karasinska, director of the Ringier Axel Springer Polska Foundation, whose leadership continues to elevate global health narratives today. Thank you so much for being here today, and let's get started and welcome our distinguished moderator.
Thank you very much, and I just want to tell you that my predecessor is an activist, a youth activist, feminine youth activist, so big applause for her and what she's doing. Thank you. Okay, listen, dear attendees, we welcome you again on the World Woman Davos Agenda 2025, and this is really an important topic, as all other topics, but it tackles all of us, no matter where we come from, or no matter what age are we, what work we do. Health, women health, is something that we deal throughout our lives. So please join us on stage, amazing panelists and experts, Tanja Brücker, Julia Falk-Vanego, and Anna Frelsen. Please join me on stage and welcome them. So welcome again. I will tell you more about our experts. Tanja Brücker is Executive Vice President of Hologic from Switzerland. And Julia Falk-Vanego, I hope you it's okay, she's a Global Public Affairs Director from SCT, and you come from Sweden? Yes, good. And Anna Frelsen is the CEO of Maternity Foundation from Denmark. Welcome. You know that issues interconnected, many layered issues of gender inequality and women's health still remain a critical barrier in global growth and well-being. Women's health directly impacts economical stability, workforce productivity, and community welfare. So investment in this area is really essential for equitable growth. Tanja, I would like to start with you. What are the most pressing barriers in healthcare for women, including mental health and well-being?
It's a big question. I've got two that I'll come back to, but I will summarize some of the other sessions that have happened around women's health, global women's health, across the past couple of days. Barriers exist in awareness, both at a GP level as well as at the female level. Access, both in terms of the physical access, but also the ability to access healthcare provisions or advice online. Awareness in terms of how aware a woman is that she has an opportunity to access preventative care, for example. It's also attitudinal. There are barriers there. Women ourselves, put your hands up, ladies, those of us that have actually made your annual appointment to have your breast screening or your cervical cancer screening done. New Year's resolutions, that's right. So access, awareness, affordability is a big one. Attitude, advocacy, there's a lot of advocacy out there. One of the opportunities, not barriers, is how we join all of the advocacy voices into one to be able to create a much more profound platform of both data and information, which leads me to one data point, or one of the main barriers I'd like to speak to, and that's data. Many governments around the world lack meaningful and comprehensive data on their populations, especially those that are the most marginalised or underprivileged. Something as simple as a census, a population register, underpins and supports a population-based screening program. Without knowing where all of the women are in a country, how can you implement a program? There's many other data points, but I will point out population data as probably one of the biggest barriers. And I think the other is the way in which our healthcare system is designed. As a registered nurse, registered midwife, and someone who's been working in the medical device industry for 30 years now, one of the greatest hurdles that we're facing is that the entire healthcare system is designed around disease. It's not designed around health. Medical systems are funded around disease treatment. It's not funded around health or preventative care. So prevention over cure, data on the entire population, and then elevating the awareness, access, and affordability, those are some of the barriers I would call out.
Thank you, Tanya. I don't know, probably most of you know the book, and that was for me many years ago a big eyes opener. Carolina Criado Perez, Invisible Woman. One of the chapters is about lack of data and how the science and medicine is not actually accounting for women's health, women's bodies. And students of medicine are not being taught about female physiology, about female diseases. So this is something really, really lacking. Anna, I'm looking at you. I remember we talked a couple of weeks before, and you told me that your foundation is dealing with maternity and helping midwives in poorer and less advanced countries. And you gave me really a powerful image that how midwives in these countries work and operate, and what tools do they have?
Yes, but maybe just if I could add to that, so on the data point, and within maternal health, still today 800 women die during childbirth, and they die of preventable causes. 800. So this is, I normally draw the picture, this is 2 jumbo jets crashing each day of pregnant women. And most of these are preventable, and the far majority of these deaths happen in the remote and fragile settings around the world. And this is not an agenda where we need to invest in advanced equipment, hospitals, or even doctors. Most of these deaths can be prevented if women have access to basic quality care from a midwife. So, and maybe just also then adding to the data point, still today when we're talking about how we are doing in maternal health, we measure it by how many women die. Imagine that you have such an essential agenda around maternal health, and then when you want to discuss it, you talk about, are the women dying, yes or no? So, I think we need to change that narrative to talk about the health and the well-being of the women within maternal health. So, but if you're moving down the mountain here, you're taking the plane somewhere to some capital somewhere, let's say in sub-Saharan Africa, and then you move to the one of the remote or fragile settings where these deaths mainly are happening. There you will meet a midwife, hopefully, most likely. A midwife that is often working, in a very, in a health facility somewhere. She might not have running water. She might not have electricity. But she has access to a mobile phone. And that really does provide an opportunity to support these midwives with essential guidance that ultimately can be life-saving, but also prevent some of these, life-threatening emergencies during childbirth, but also make sure that she has respectful care at the birthing setting. So at Maternity Foundation, what we have done is, in terms of tap into the mobile technology opportunity, we have developed a simple app that addresses some of these preventive measures and also trains midwives in handling childbirth emergencies. So, to give an example, bleeding after birth is one of the main killers during childbirth, and you can prevent that from happening if you have the right qualifications first and foremost. So training these midwives in the front line in handling these emergencies can have a massive impact. We have, and then I'll stop, we have, last year alone we reached more than 50,000 midwives in remote and fragile settings in Afghanistan, in India, in many sub-Saharan African countries, with localized instructions, accreditation opportunities, and day-to-day guidance in how to do this. And what we hear is that now we know what to do. Now we do not have to sort of refer the woman in an ambulance for a few hours. We can handle these emergencies on the spot.
Thank you, Anna. When you were speaking about undeveloped countries, poorer countries, I realized, guys, I come from Poland, and this is European Union country. And for the last 8 years, when the right-wing conservative government was ruling, they really gave stricter law on abortion. So actually, Poland is one of the strictest country in Europe as far as abortion. Abortion is not legal, even if the woman's life is threatened. And the doctors are afraid to help in the hospitals. And in the last couple of years, at least 5 women died in the hospitals being pregnant because they were not given help. So this is the reality in European Union. Thank you.
Can I just add, unsafe abortions is, I think it's 17% of all maternal deaths is due to unsafe abortions. So.
Okay, so moving forward, Julia, can you explain at the beginning why menstrual health is critical? And I know some experts on the are with us because from the Sex Ed organization, but why menstrual health is so critical for rights, women's rights?
Absolutely, thank you. What a joy to be here in a room full of power, a room full of women, and as you said, it's a really dangerous thing to be pregnant. But women are dangerous. But let me start with a point of reflection, if I allow. For those of us in the room who experience a menstrual cycle, thinking about your first period, thinking about menarche, what comes to mind? And just hold that thought for a while. Because we know that 75% of women and girls, and those who menstruate worldwide, say that their first period experience, menarche, was not a confident one. And at SET, where I work, we believe that the first period should be fearless, because we know that the very first period also impacts the life cycle of menstrual health. So you fix the first period, you fix a lot of experiences throughout the menstrual cycle. And for those of you who don't know SET, just quickly, we're a global hygiene and health company. We're headquartered in Stockholm. We do hygiene and health products, services, and solutions. And part of that portfolio is period care product. So we're in the period business. And we're committed to really close the menstrual health gap. And you might know us, if not by name, but through our brands. So in the UK, for example, it's Bodyform. In the Nordics, it's Libresse. In Mexico, it's Saba. Australia and New Zealand, it's Libra, just to put a name to that. But we're a purpose-driven company, and therefore we're committed to closing the gap in menstrual health. Now, menstrual health, it's the physical, it's the social, and it's the mental well-being in relation to the menstrual cycle. From the very, very first to the very last, from menarche to menopause, the life cycle. And why is it a matter of rights? Well, menstrual health is a matter of rights because it impacts your right to education. Thinking about
obstacles in terms of going to school related to period pain, for example. It's about your right to work. Our workplace is rigged for the menstrual cycle. Do you have period care products in your washrooms? Are you able to take leave without losing pay, and so forth? And it's about your right to non-discrimination, of course, also gender equality. And we know that at any point in time, 1.8 billion women and girls, transgender men and boys, non-binary people menstruate. And many do so lacking access to safe and affordable period care products, to safe and private sanitation facilities, washroom, bathrooms. And many don't have enough knowledge and education about the menstrual cycle and how to care for yourself in relation to menstruation, for example. And many experience a menstrual cycle or have their period in an environment that is not free from stigma and discrimination. And that is why it's a matter of rights.
Thank you very much. Tanya, tell me, what are your thoughts? How can nations, how can organizations redesign health system? So could be women's health issues can be served better, and how we can expand access to women and unrepresented, underserved groups.
So just for a little bit of context, Hologic, the company that I work for, is also purpose-driven. We're driven to be the champions of women's health. We're probably the biggest company you haven't heard of, and our sole focus is around women's health conditions such as breast cancer, cervical cancer, and abnormal uterine bleeding such as heavy menstrual bleeding or other structural uterine conditions. In addition to that, we're a company that identified that because countries, governments lack the majority of the data that they need to design healthcare systems or policies or funding decisions around women's health, we invested 4 years ago in a global study. It's now in its 4th year, 142 different countries and over 146,000 women individually interviewed to get their perspectives on health, their access to basic needs such as food and shelter, their perspectives around safety, so gender-based or domestic violence, and how often they get the access to preventative care such as blood pressure, such as diabetes, such as STIs or STDs, or such as cancer of any type.
What's the name of the study?
This is called the Hologic Global Women's Health Index. Freely available information on our website. We make it deliberately very public. All of the data points, there's billions of data points around the health and equity for women in all of those countries. And because it's now the 4th year in the study, this is comparable data year after year after year. That data is aggregated at a global level, at a regional level, for example, Europe, at a country level, and then within that, on each of the 5 disease or dimensions of health that we look at. You can go from whatever country you're at and access that information, and we are beside you in taking that information to every government. Coming back to your question, what can governments do? They can look at the data as they make their decisions around how to drive policy. One of the things that we're active around is working with the European Parliament and the European Union to set up a women's health policy. To the best of my knowledge, there's only 3 countries globally that have women's health policies in place, overarching policies that drive different other pillars of strategic focus. And those countries are Australia, the UK, and Ireland. While there may be other countries considering it, our focus, and again coming back to your question, what can governments do? They can implement a data-based or evidence-based women's health policy. They can drive individual funding decisions around what they find out from the women within their countries, and they can maintain a persistent focus on ensuring that the medical system is aligned to those strategies and funded accordingly.
Thank you, Tanya. We have 5 more Swiss minutes, so I'm trying to keep to Swiss time. So last thoughts about solutions, because I know, your organization, your foundations also have a lot of experience. Share your thoughts. what should be done in the future? What are the path forward?
That's a good question.
In your field also.
Yes, of course.
Because you use technologies. Actually, I was thinking about technology. How can we use technology to address these issues?
Yes. So, I mean, for sure, one thing is important is that there are no quick fixes and there are no magic bullets. And also, technology is not a magic bullet. I also think on one side, what we do is that we have a free global good that gets localized and that needs to get into the hands of as many midwives as possible. And that model of having a free global good is very different from sort of like a traditional being a project or pilot type of organization. So it's really just about seamlessly getting best practices, approaches, and technologies out into the local programming and humanitarian responses. In the short term, when we think about technology, you also have to be very mindful about what the type of context or ecosystem that you're operating in when you are in the most remote settings. Often there's not even internet connectivity. I did mention before that there is mobile technology, but often not internet connectivity. So really when you design solution, design it with that sort of context in mind. At the same time, technology can be, we just had a session 2 sessions ago about AI. I mean, it's going to absolutely revolutionize the way that we can overcome barriers to access, in the way that we can personalize care. We can make it much more intelligent for that specific context. And there, we are already now in India, we are working on AI, again, that works offline, but that is making the care much more personalized for each mother and midwife. So I think technology can be a huge accelerator in making a difference also in this agenda.
Thank you, Anna. Julia, 2 minutes, I think. Your message, what would you like to leave the room with?
Thank you. Women and girls have been waiting far too long to attain the right to health, to menstrual health, and we really need to flip this script. We'll call for a menstrual health in all policies approach. That means each and every sector of policy need to address menstrual health. Otherwise, we're not going to get no changes. So we need menstrual health in education systems, in work and employment systems as well. And it needs to be evidence-informed. Back us in that. Join us in the rallying call to close the menstrual health gap and make it happen now. Thanks.
Yes, maybe last message from you.
Last message. I'm going to make it personal, ladies. If you haven't booked your breast and cervical cancer screening program, please go and do it, because we're all advocates for that as we walk outside this room, as you talk to your colleagues, your friends, your family. Please put your own health first. That's probably one of the most fundamental and easy things that we can all do for women's health.
Thank you very much.